The first most important thing to know about eligibility for these grants is that you must have signed the data sharing agreement to apply for them. If your organization has not yet signed the California Data Sharing Agreement, but you're interested in signing and want to apply for these grants, that's your first step. You can go to the online data sharing agreement signing portal that's linked to the Data Exchange Framework state website and get started on signing. After you do that, the second piece of eligibility is a demonstrated health IT need. So in order to apply for this funding, your organization must have something that needs support within your organization. So whether that's upgrading an EHR, or you need a new technology system, or you need training for staff on this workflow, there needs to be a demonstrated need that this funding can help your organization with. If you meet these two requirements, then congratulations, you are eligible to apply for the DSA Signatory Grants. The next step is deciding which of the two pathways under this grant opportunity makes the most sense for your organization. So the Technical Assistant Pathway, or the TA grant, is a do-it-yourself pathway. And that means that organizations decide their grant milestones, their potential budget, how they want to spend these dollars to support data exchange capacity, and manage the grant application and the dollars themselves. So if you are interested in applying for funding directly to your organization, you have an idea for how you want to spend that grant funding to improve your data sharing processes, then you might choose the TA grant. The second pathway that an organization could choose is the QHIO onboarding grant pathway. And this is a little bit different than the first TA grant pathway because it's described more as an assisted pathway. This pathway is for organizations who want to connect to a health information organization. So to apply for this grant, an organization would work with QHIO, the California Association of HIEs, or Health Information Exchanges, who's contracted with the state of California to support local organizations in completing this application and identifying how they can connect to a QHIO, a Qualified Health Information Organization. So the grant funding under this pathway offsets the connection to the QHIO. It covers the onboarding costs for your organization, for example. And in this pathway, very importantly, the funding and the application process is managed by that health information organization. It is not managed by the organization itself. So if your organization perhaps feels that it would be a heavy lift to manage the grant application process and manage the funding coming in, but you are really interested in getting connected to a health information organization, this QHIO onboarding pathway might make most sense. To decide which of these pathways makes the most sense for your organization, I'd highly recommend reaching out to the QHIO team, the California Association of HIEs. Even if you think that you might be wanting to go the TA route, a conversation with QHIO can really help your organization identify where you can get the most value for this funding under each of these pathways. You can find more information on California's Data Exchange Framework at familydocs.org/DXF.